Good morning, everyone, and welcome to the 2022 Grantees Position for Success Seminar Series, as hosted by the Georgia Rural Health Innovation Center at Mercer University School of Medicine. Today, we are pleased to host our final grant seminar session entitled Activity Assessment Amidst Implementation. This is our August session, and we're proud to have our guest speaker, Dr. Brad Lian. Dr. Lian is an associate professor in the Department of Community Medicine and the co-director for the Rural Health Sciences PhD program in the School of Medicine here at Mercer University. His research interests revolve around poverty and human development, and he has been the lead evaluator for an HRSA-funded Healthy Start program and an investigator or co-PI on several CDC and NIH-funded programs. Ladies and gentlemen, pleased to introduce to you Dr. Brad Lian.
Hey, thanks, Kendrick. Hey, Rachel. Not a big crowd, but hey, it's better than nothing. Well, do you have a lot of experience with evaluations by any chance?
Sorry, I was trying to unmute. Not a lot, but okay. I like to stay close to people who do. I work for the Heard County Community Partnership. We're the family connection organization in Heard County, and we administer a program for early literacy intervention called Baby Braves. And it is now in its 7th year. And our first group of students that we enrolled in that program have just completed 3rd grade last year. And so our target, piece of data was 3rd grade reading, and we're ready to start looking at some of that data to see how the program impacted those children. So we actually talk a lot about data and evaluation and have a couple of partners that support us in that. But personally, that is not my strong suit, forte, interest, passion at all.
All right. Well, I appreciate the background and the babies thing. That will be interesting to see your outcomes. That'll be really that's the fun part, kind of. Family Connections. I'm just a big fan of the work that Family Connections does. So thanks for doing everything.
Thank you.
Well, today I'm going to start with a couple opening comments, and this might be too simple for some of you, or for you, but let's just start from the beginning and then go from there. And then I have a PowerPoint presentation that'll take a half hour, so I don't know. But we're going to be talking a little bit about evaluations this morning, and a lot of the time, evaluations are afterthoughts, or a lot of times people get grant money, and a lot of times nowadays, though, it's part of the grant. It's a requirement of the grant. You need an evaluation component. But 15, 20 years ago, it wasn't always like that, or 30 years ago. They're just, people would get these grants, and then, well, at the very end, you also need an evaluative component, so it's 5% or 10% of the grant requirements. But so people didn't take them too terribly seriously, but they were, I don't know, they still were required. And I can't really blame directors and administrators for not taking evaluation that seriously sometimes, because a lot of directors would rather spend their money on the programs, the clients, the salaries, rather than the evaluation. I mean, and I can't really blame them. That's probably why we're not required to do major evals every month or major evals every 6 months. You usually just do a major evaluation at the end of a cycle, or maybe every 2 or 3 or 4 or 5 years. They're not, you rarely do major evals every 6 months. But you need some balance, and things have to be evaluated just for efficiency's sake, if nothing else. And you can end up saving a lot of money if you do evaluations along the way. But every evaluation is, and every situation is somewhat unique. They're learning, evaluations are learning and teaching moments, and it's nice to get input from others at each stage of the process. And there are lots of ways to accomplish your objectives besides just, there are lots of ways to accomplish your objectives and to do things. The different ways to do them can all lead to good, and by good I mean useful and valuable outcomes and reports. Reasonable people can disagree, on a lot of things. And likewise with evaluators and stakeholders. Reasonable people can, with the best intentions, can disagree. Now, defining what's a good evaluation can be difficult. People use different criteria. Usefulness is probably the most common criteria that people use. But if you think about it, what's useful and who's it useful to? So maybe getting it done or completing it should be the most important criteria. In any event, you can usually identify a pretty lousy evaluation easily. You just want to avoid, when you do evaluations, you want to avoid egregious errors or things that are clearly unusual or don't really make a lot of sense. You just can't do things that are absolutely kind of absurd or crazy. Today, we're going to focus on a specific type of evaluation. It's called a process/implementation evaluation. Some people separate them. And they say they separate them. There's a process evaluation and an implementation evaluation. They're slightly different, but for the most part, a lot of people use them interchangeably. CDC uses them interchangeably. They are usually done for longer-term grants or for organizations or agencies running programs. They're not usually done for service, something that's you got 50,000 to execute something and you have 6 months or a year. These are usually for like your program, your baby's program. You're going to evaluate it along the way, and then you do an output or outcome evaluation or impact evaluation at the back end. So these are usually for longer-term grant cycles or organizations that are running programs. They're in-house evaluations a lot of times. The process evaluation is likely, may likely be part of the final report along with this outcomes evaluation. The output of a process or an implementation evaluation is often brief. On bigger grants, there are often quarterly reporting requirements and templates, and those are generally progress reports. So you may have quarterly requirements for your grant or for your agency. You might already have templates. They're basically progress reports intended to keep people and funders up to date regarding the current situations. A lot of the time you'll use that data and add to it in some manner and call it an evaluation at the end of the day. Those documents don't have to be all text. They don't have to be 25 single-space pages. Many process and implementation evaluations have lots of charts and tables, and they might be between 2 and 6 pages or 2 and 10 pages. It just depends. The point is that these process and implementation evaluations come in different flavors and sizes, and you have to do what's best for your situation. So when you're doing evaluations, a lot of times, again, people think it has to be a 40-page document, and sometimes that's not necessary. It depends. You have to do what's right for your situation. It just has to be reasonable. So I think we can all see the value of evaluations, but doing them is easier said than done for a lot of reasons. You have time issues, you have program issues, you have money issues. You know, at the end of the day, the funders just want you to try, right? You need to show that you're trying to be responsible and doing the right thing with their money that they're giving you. So you just need to show the funders that you care and that you're trying to get this stuff done. So today we're going to, again, talk a little bit about process evaluations. And can you see this screen? Is it shared? Okay. Activity assessment amidst implementation. The objectives today are to reflect. There's 5 objectives, and this will be available after the presentation. Reflect on the purpose of the grant, review various types of evaluation, focus on process evaluations, or then an overview of data collection techniques, and then pitfalls. So we'll start by the purpose of grant-funded activities. Why do agencies, why do they want you to review things mid-cycle? Do you have any, you can unmute if you'd like, Rachel. Do you have any comments, or why do you think people want you to evaluate midterm or mid-cycle? Well, a lot of times when you're getting grant money, grantors have conditions. They want you to spend the money responsibly. They want you to provide updates, and they want you to create impact. I mean, these are reasonable expectations from people who are giving you money to do a job. And so updates are reasonable to allow for adjustments and more guidance. They may help you better form the program. These updates often play a formative role. So, because a lot of times when you get money to execute programs or interventions, theory isn't always equal to practice. All right? In theories, when the rubber hits the road, it's not always, the outcomes aren't always what you intend. So these updates, again, are very reasonable. Such updates are considered formative evaluations because they assess the program during the process while it's forming and not while it's finished. How can things go wrong between theory and practice? Well, the settings could be different. The personnel could be, you get personnel issues. Participants may not be as accommodating or who you would expect sometimes. There could be internal and external factors. The support level of support among different agencies and different locations might be different. So again, theory isn't always equal to practice. And so it's reasonable to have updates and examine these processes. And so today we're going to talk about these process evaluations. And they're the most appropriate tool to use when we're assessing ongoing activities. Objective 2, what are some types of evaluations? Well, there are two classes of evaluation, two types of evaluation. There's formative evaluations and there are summative evaluations. Formative evaluations are those that focus on the process and how the project is formed. These judging the worth of the program while the program is forming and while the activities are happening. They focus a lot of times on processes and they collect continuous feedback. One of the type of formative evaluation is a needs assessment. Needs assessments, they're usually done before a program starts to determine whether there actually is a need for the program. What's the nature and magnitude of the problem? For whom? What are the characteristics of the population in need? What are the needs of that population? How much service is needed over what time period? What service delivery arrangements are needed? So that's you want to do a needs assessment before they start the project just to get determine whether it's feasible and whether what is the actual need. Then the process evaluation, implementation evaluation, that's what we'll be talking about in a second. That's another formative evaluation. How can the program identify and recruit people? We want continuous feedback on the activities that we're executing. The other type, so those are formative evaluations. Summative evaluations, they focus on outcomes. They look at the consequences or outcomes of the project. And that's probably what you'll be doing, Rachel, for the babies program. You're going to look at the outcomes after they graduate 3rd grade and beyond. They judge the worth of a program at the end of the activity. Again, the focus is on the outcomes. And there are outcome evaluations. There are different types of these: cost benefit evaluations, impact evaluations. Impact evaluations, though the outcome evaluations focus on where objectives met. They're more specific. Attendance will increase by 10%. Well, did that happen? The dropout rates were cut by 20%. So outcomes are very specific usually. Impact are a little bit broader. Where the goals met. Goals are a little bit broader than objectives. So people will be healthier. The kids will feel better. The parents will have a better relationship. But that's impact evaluations. Usually you're looking at impacts over, between 1 and 5 years after the grant a lot of the times. So there's the two types of evaluation, the formative and summative. And again, today we're going to be talking about process implementation evaluations. An overview of these. So what is a process implementation evaluation? Again, it's a type of formative evaluation. And they ask what? When you're conducting these evaluations, keep in mind these 3 questions. What is the program intended to be? What's being actually delivered? What are the gaps between design and delivery? They also focus on who's attending the programs, how are they hearing about it, are the clients satisfied, are administrative, organizational, and personnel functions handled well, how do you recruit people, how do you sustain the program, how do you identify people to be in the program, just anything involved in the program. We're going to talk a little bit later about the questions that you would ask in these process evaluations. Generally, these process evaluations use empirical data to assess the delivery of the program. They verify what the program is and whether it's being implemented as designed. In contrast to these outcome evaluations, which assess the impact or some of these specific outcomes, process evaluations assess how changes are produced, not necessarily the impact at the end of the day. They're more interested in the activities that are currently going on or they're actually going on, not necessarily on the overall outcome of changes in behaviors, because those would be like 2 or 3 years down the road a lot of times. So it's a type of formative evaluation. Why would you do it? Well, again, for formative purposes, to fine-tune a program, to determine whether the activities have been implemented as intended. Again, theory and practice often aren't the same. So they help ensure that the program is feasible and acceptable. People use it to make a judgment on whether, again, it was implemented as expected. It's used to interpret and explain program outcomes, analyze how a program works, and provide input. When we talked about why where grantors use it, we talked about these things: to determine the extent of the programs being implemented, to assess the degree of fidelity within a program. And fidelity is really the quality of the program and the consistency of the program, because sometimes these programs are administered at different sites, and it's really you want to make sure that the program is being administered similarly across the sites, or be consistently across the sites, and it's being fidelity also is a reflection of the quality of the program. Is it being are the people who are leading the program, are they doing what they're supposed to be doing? Are they doing the activities that are supposed to the way that we want them to be run? To understand, another reason why they do it is to understand the relation between context and processes, to provide feedback, to refine delivery components, basically just to improve the quality of the program. So they just make sense. Process evaluations make sense. They're required as well in a lot of the grants. And again, that's why you have these templates, or you have quarterly reports a lot of times. How do you do a process evaluation? And this is the meat of today's talk. There are 3 steps, and well, I narrowed it down to 3 steps. I think this is pretty simple. You first want to describe the program. To do so, you got to know the program, know the details and elements. And so I would suggest that you revisit that logic model. What activities are supposed to happen? Why? And what are your anticipated outcomes for these programs? And then so the first step is really to understand the program. And the more you understand, the better questions you can ask or come up with. The second step would be to determine and develop a list of those questions. And then the third step is to determine the methods used for process evaluation. So you want to understand the program really well, come up with a list of questions, and then figure out how you're going to the methods to get these questions answered. It's pretty straightforward. We're going to go through each one of these steps. The first one, again, understand the purpose, the objectives, the strategies. Doing so is going to help you better understand the activities implemented and how to best assess them. Are there theoretical variables of interest that might influence the outcomes? So you want to describe and understand that program. And again, the best way to me because I'm more of a visual person, is to look at the logic models. Okay, who's involved in the program? What activities are we supposed to be playing around with or executing? How can we start to analyze them just descriptively? And then what are some of the outcomes in the, maybe in the first year, 2 to 3 years, and maybe 5 years or down the road. But so networking events, okay, well, that's an activity that we want to have networking events. If I'm doing a process evaluation, I want to say, okay, well, how many? So that's, you know, then that's part of the outputs, number of networking events. But I might want to also know who's attending, where it's located, what times do we offer networking events. I want a little bit more than just the logic model necessarily. Socials, number of socials. Well, who attended, when were they, things like that. Engaging in advocacy platforms, number of briefs developed, number of briefs that were successful, a number of people who proposed briefs. Another logic model, again, inputs and activities, provide alcohol and drug screening sessions. And well, we hope to have 250 individual screening sessions. Well, where are they? Who attended? Were people happy with them? Was the staff happy with them in the clientele? Who didn't come to them? These are questions that you might ask in a process evaluation to get a little bit thorough or more details on how the programs are actually working. So you, again, when you have a logic model, it's again really nice to look over, but and they do have basic details, but we want to go a little bit deeper when we're doing evaluations. But they give you a good roadmap. Make referrals, 15 orientation sessions. Well, who was referred? Where were they referred? And this is the program development for, I don't know what agency this is, but inputs, who we have, and then they want to conduct workshops, deliver services. These are their activities or their interventions maybe. And this is, they're interested in reach. You could also be interested in fidelity. You could also be interested in dosing and things like that, but satisfaction. Conduct workshop. Well, how many workshops? Where? How many people attended? What was the satisfaction level? What did the instructors feel about it? But these are, again, the point is to understand the program. I would refer to the logic model a lot of times and just get a quick overview and then start thinking from there. So again, step one is understand the program, get the details and elements. The elements were developed to position the project for success, of course. So how are they supposed to work? Were there strategies involved, training, marketing, incentivizing, deterrence? Are they at the individual level? Are they community level? Are they policy level? What are some of these strategies and were they effective or not? And why? Activities and staff behaviors. So these are elements of the program and activities. The logic model can tell you what and how. Sometimes it can tell you how, but not necessarily why. So a process model can help you determine why. Second, so understand the program. And again, that logic model is important to me. Step two is determine and develop potential process questions. How can we assess success? Common evaluation elements in process evaluations are, they deal with fidelity again. And fidelity is the quality of implementation across sites and making sure that things that they're consistent as well. Dose is the amount of program delivered by the implementer. What was it? We're going to offer this program, and we're going to have this program plus something, or we're going to offer this program. We're going to skip some sessions in this area, and we're going to do a little bit more enhanced program in this area. So the dose might be important. Is it delivered at full extent or modified extent or full extent plus something? So you want to know the dose delivered and dose received. The extent which in the dose received would be exposure, maybe like how were the participants actively engaged? Did they interact? Were they receptive? What are the expected reactions or behaviors of the participants? So when you want to look at the consistency of the program, the quality, which is related to fidelity, and the dose, how much the program was received by the participants, and whether they were satisfied, and where it was delivered. The other one is reach the program. How many people participated? the proportion of the intended priority audience that participates in the intervention, how many people did you catch and or did participate, and were they the people that you wanted to participate? And then if they didn't participate, people didn't want, why didn't people participate that you wanted to? And how long did they participate? Recruitment, that's another, what was used to approach and attract participants at individual levels? You might want to document any recruitment efforts you had. Oh, we used flyers, we used public service announcements, we used word of mouth. But how were people recruited? And were those recruitment strategies successful or not? Were there any barriers to recruitment, or was it rainy? A lot of the external factors or whatever. The another thing that people want to you might want to consider is context, and that might be the weather, or maybe a political event occurred, or there is something came up that one of your events had to be canceled. Any environmental influence, maybe a control group might have been exposed. Like sometimes I had a project with teen moms, and it's very hard not to have, if you're having a program for teen moms in a certain neighborhood, you can't really exclude some teen moms, and because it's a small group of, a lot of the teen moms will know each other, and so sometimes you can have contamination. Okay, well, I just want to invite these teen moms. I want to have this control group of teen moms. Well, sometimes you can't do that just because they're going to get the information from their friends or whatever. So you have to worry about this context, and are there any there could be contamination because people are getting your information that for whatever reason. So a lot of these elements that we're interested in are fidelity, dose, reach, recruitment, and context. You want to create a full list of questions for each activity that can maybe address some of these issues. Many of the questions on process evaluations can be answered via basic tracking and documentation. So when you have events, a lot of times you have sign-in sheets, and let's not overlook the obvious. So number of consultations, number of workshops held, and this is the outcomes when we go back to those logic models. A lot of times they just have how many people participate, and they're just documenting numbers, and counts. And so number of referrals, amount of service delivered, and duration. So these are other items that you want to address during a process evaluation. So consider the importance and purpose of each concern and each question. Again, some are simple and based on these reports that are you do just login sheets, but don't overlook the basics, the basics and simple questions. Again, you want to look at fidelity, dose, reach, recruitment, things like that, but there's also just the basics. For that might be like who's the target audience? And this is, I'm going to give, well, this will be in the presentation, so you can use these as a reference later on. But if you're asking about who you might want to consider the target audience, who's eligible, how many people have participated, who declined, how many people have dropped out, what factors do these guys, the clients have in common, and how satisfied are the clients? That's who. If it's staff, you might ask staff, okay, or you might find out about who delivers the service, what qualifications does staff have, how are the staff trained, what are the staff demographics, how supportive is staff with each other, where where does the intervention or activity occur, what type of facility is used, because that could make a difference. What's the condition, is parking available, is childcare available? So there are where components of an evaluation. When is it conducted? At what intervals? What time of the day? And the duration. So you have who, what, when, where. What happens? What's being delivered? Again, just basic questions. What types of communication are implemented? What types of organization deliver the program? What are the methods of service delivery? And then why are these activities implemented and not others? So that's just a justification and rationale of the project. You thought that out when you created the logic model. And then Why are clients not participating? Why is the intervention varied in ability to maintain interest potentially? Why is it conducted at a certain time or certain frequency? Maybe the program would have been better if we would have conducted it less often or more often or at different times of the day or week or month. More broadly, some questions in typical questions in process or implementation evaluations are, what's the component at the end of the day completed as indicated? What were the barriers and challenges? What were staff perceptions? Did people actually understand the intervention? And what were the strengths and weaknesses? So just, again, this this presentation can be used as a resource if you want some questions for, I got to do a process evaluation. I need some questions right off the top of my head. Evaluating the questions after you decide on these questions, or you make a long list of all the questions that you might consider to ask. I would probably go through each one of those questions and ask yourself, do I know why each question is important or valuable? And if you say no, can you figure it out? Or that might not be valuable. But if you can't answer like yes to this little set of questions on this slide, then you might consider dropping the question. Will I use data from these questions? Yeah, this question is good. I don't know if I'd ever use the data. So I might ask it. And if I might use it, I might still include it. But if there's no, I just thought of that question because I wanted to write down every question I could think of, but there's no way I'd ever use this question. So I'm going to drop it. Is someone interested in each of these questions? Well, if I'm interested into the questions, that doesn't mean everybody's going to be interested in the question. So are my funders interested in the question? Are the people on my team, or and I don't want to just ask for, I don't want to waste people's time to just get my questions answered. So is someone else interested in these questions? Yes or no? Have I ensured that no questions are admitted that may be important to somebody else? Are they a sufficient set of questions to achieve the purposes? Is it feasible to answer the question given what I know about the resources? So yeah, that's a great question, but I don't think we have the resources to actually answer it appropriately. And sometimes poor information is worse than no information. Is each question worth the expense of answering it? So just after you create a comprehensive list of questions about each activity or the program, just review it. Review each question. And is this a worthwhile question? Do I really need this in the evaluation? There's a balance between, or a trade-off between too many questions and too few questions, and the time that it takes to get this stuff done, and the hassle to get some of these questions answered. And so you just have to play it by ear and do what's best for your situation. I'd also, after maybe when you're deciding, when you're going through which questions to include or throw out, have others sit down with you during that process. And that's, I don't care who it is. It could be somebody who doesn't know anything about the program. It could be somebody who's intimately familiar with all the details, but just get another perspective. And the more the merrier, and just get everybody on the same page. But have others review them well, because there's a lot of times when we develop questions and we run it by one or two other people, and sometimes they pay attention to it, sometimes they're just trying to appease us or whatever. But a lot of times when we come up with these questions, we think they're fine, we roll it out, and then you find out, oh man, this could be interpreted this way, this way, this way. And now it's just if I would just made one little change to that question, I would have got so much better data, or more interpretable data. So always have others review them. It can never hurt. And you always want another perspective. Last step, so you understand the program, develop a comprehensive list of questions, review the questions, make sure that they're appropriate or not, and that you actually need them. And then, okay, how are we going to collect this data? So the last one is determine the methods for required for process evaluation. And that overlaps with our fourth objective of the day, which was an overview of data collection methods. So I'm just going to lump them together. So the fourth objective for today's discussion was overview of data collection techniques. That's just straightforward. How will you collect this data? You got to consider speed, cost, data sources, management strategies, data analysis. Got to think about turnaround time. A lot of things you have to think about when you're when you're collecting the data. And Rachel, I know that you probably have to, you're intimately familiar with these issues. You can have primary or secondary data. Primary is stuff that you collect, or you have a hand in collecting firsthand. Secondary data is already existing. Quantitative or qualitative data. Quantitative is more numbers based. Qualitative data is basically looks at the the quality or the why questions. It's a little bit more text based. It doesn't have to even be text. It could be pictures or whatever, but it's just not necessarily numbers oriented. It's anything besides quantitative data, essentially. But they both complement and supplement each other. I would recommend getting, if you can, do both. Get quantitative data because it does give you the numbers, but get qualitative data that tells you, it explains a little bit more and could add value to any discussion. Like, okay, well, I know that 60%, but it's because of this, and it just adds, can make your analysis or your output a little bit richer if you have some qualitative data with it. So a lot of times when you do your evaluations, you use both. You need to figure out how much information and you need to collect. How many cases do I need here? How many bits of data do I need to have a valid evaluation? Can I generalize on a sample size of 1? Do I need 5,000 people? I don't know. Sometimes you can generalize on a sample of 1. Depends on what the issue is. Sometimes a sample of 1 isn't meant to generalize. It's just meant to give you the possibilities, what's possible here. So the sample size is just, everybody kind of has a different view on sample sizes. If it's a quantitative study, you probably want at least 10 to 20. A lot of times people say you want 40 per group, 40 bits of data per group. But again, you do what you have time and money for. There's other things that are involved here. When you collect the data, there's three methods, kind of interviews, and those can be structured or unstructured. And structured to be like, you have a list of questions. I want to go down these. I'm going to ask question 1, then 2, 3, 4 in this specific order, and I'm not going to deviate. And everybody's going to be doing it the same way. Unstructured could be like, I'm just going to bring a tape recorder, and we're going to talk about this program in general, and whatever comes up, comes up. And a lot of people have what they call a semi-structured interview, where I have a list of questions that I'd like to get to. I don't have to go in this order necessarily, but I want to let's try to get to these today. But interviews, it's better to probably tape them, just so you can clarify things later, because it's a pain in the neck to record everything by hand, and you make mistakes sometimes. And so that's one way to collect data. If you do interviews, you probably, again, it depends on how many people are involved, but if you're doing a community survey, a lot of times we want about 12 to 15 interviews to get a kind of a variety of opinions. It's the more people you interview, the better you feel about generalizing over the results. If you just interview 1 or 2 people, sometimes that's good, but sometimes it may not be. So generally, the more the better. But when you look at research based on interviews only, a lot of times they're based on, I'd say, between 10 and 20. Focus groups. That's another thing you can do. You can get groups of people together, your staff or whoever, and you can ask them about how things happen. Their focus groups are usually between 6 and 12 people, because you want to give everybody individual attention, kind of, and everybody a chance to participate. You probably have done focus groups. You're probably familiar with focus groups. Most people are at agencies, or at least are familiar with focus groups and the concept. But that's a great way to collect information as well. Another way to get information is questionnaires, and those are can be within your agency or they can be in the community. A lot of times you can't find secondary data on your specific topic, so you have to create your own. You have to do primary data collection, and if you're doing questionnaires, there's some tips, and this will be available to you afterwards. Also, tips for questionnaire development. I would always start with an introductory message or a cover page, and then try to have brief introduction anytime you switch topics or whatever. Make the survey easy on the eyes. Don't use size 8 font. You need some white space in these things. Consider how the data is going to be entered. Make sure your questions are exhaustive. And they cover all bases and have all possible answers. To make sure they're mutually exclusive. Consider the way you're going to order the questions. You want to keep the wording simple. Avoid double-barreled questions, like questions with "and" in it or something. Avoid loaded questions, so make sure the results are interpretable. Avoid questions with negative wording. They're a little bit harder to interpret. He is not hopeless. It's better to say that he is hopeful, but just try to avoid negative terming and allow DK or don't know and not applicable to some of these questions. Because again, sometimes you're going to have to create your own questionnaires to get the information that you want from the specific audience you want in a timely fashion. So there's a lot of times you do it, and don't be afraid. I can't do it. Well, anyone can do it. Just again, it has to make some sense, and sometimes just has to be done. Sometimes if you rely on pre-existing, sometimes you can get a questionnaire that asks everything you want and it's already been used before, and that's fine. But sometimes you have to create your own. When you're evaluating and doing process evaluation, who should be the ones doing it? Should it be the program staff that's involved here, or should it be outsiders? And that's, you have to think about that. The program staff really knows what to ask. They know what can go wrong. They know what actually occurs. They actually know the practice and stuff instead of the theory necessarily. But they also, they also might bring in their own biases. People might respond to them differently as well. Depends on who the staff is. So there's benefits to having program staff do your evaluations or parts of the evaluation, but there's also some drawbacks. And sometimes people say, an outsider would be nice because they're more likely to be objective and they can execute these things. And yeah, but do they really know what's the subtle details? So there's pros and cons to having outsiders do it as well. There's no one best way, and a lot of times people will have a combination of both. They'll use some insider to get information from on some components. Sometimes they use outside staff to do something, and they might use an outside source to do an overall evaluation. Then the outside source may rely on some insiders for certain things. But you really got to think about who's doing the evaluation. Insiders or outsiders, and there's pros and cons to both. And some questions may have to be answered by insiders via records, but some may require interviewing focus groups. And again, do you want somebody in your agency to be the moderator of that focus group, or do you want an outsider to be it? Do you want somebody within your agency to interview other people within the agency, or do you want an outsider? Again, there are pros and cons to that. So just think about that. Other considerations. What are resource limitations? You got to consider the skills, the program characteristics, the feasibility. And then you need someone to analyze the data at the back end too. And well, is the data going to be? These are hard ones because a lot of the times when people are doing these things and they've never done statistics or whatever, they think that they're unaware of statistics, basically, how to, they haven't had classes in or whatever. So they're intimidated by statistics, and they think that everything is super complicated and so sophisticated, and I can't do it. I can't. So, but a lot of the stuff that you do is very, very straightforward. And if you just spent a half hour understanding a statistics book or sorry, just looking at some basic concepts, you could do it no problem. So you don't have to, you can get to work every day with a Yugo or any bike just as much as a Ferrari. So you that's just when you're think about what you want analyzed and how complex it really has to be to answer your questions. And a lot of the stuff that you're doing, most people who've had a course or two in statistics can probably do your analysis. Sometimes they can't, but a lot of times, and if they can't do it, maybe they get somebody else. But I'd probably start with an underestimation of the analysis rather than an overestimation. Anyhow, the degree of complexity and expertise required. So I'm sorry that we're getting through this pretty quickly, but we wanted to reflect on the purposes of grant activities and why they would, why it's important to evaluate the processes and implementation of these programs, and not just at the very back end looking at the outcomes. We need to understand as they're occurring so we can make fine tuning if it's necessary, or we can identify problems earlier than later. And it's just being responsible for the grantee, because they're giving you money and you want to be responsible for that, to spend it wisely for them. So we understand the purpose of process evaluations, the various types of evaluation. We looked at formative and summative. This process evaluation is a formative evaluation. Understand an overview of these evaluations, what, why, how, an overview of data collection techniques, and then the pitfalls. The last one is pitfalls when you're doing evaluation. People get nervous or irritated sometimes when they hear the word evaluation. Nobody likes to be evaluated, or most people probably don't, because they always fear the worst. But so you don't want to, hey, we're doing evaluation. Maybe if you can phrase it differently or call it something else, I don't know. But people just naturally are a little bit sensitive to when they know that they're going to be evaluated. You also want to avoid heightening expectations. So manage expectations when you're doing evaluation. Hey, if we're going to do this and everything's going to work out right, this is going to happen. This is going to. A lot of times evaluations sit on desks and nobody ever looks at them after they're published or after they're done. But and a lot of times programs don't significantly change based on the evaluation or whatever. But don't say that everything's going to be fine afterwards, or things may be fine afterwards. And hopefully they'll be better afterwards. But you got to manage expectations, because people will think, we went through this whole thing, and at the end of the day, nothing changed. Then they get resentful or whatever. But just manage expectations on the front end. And anytime you get a grant, you also want to do that. You don't want to promise these communities that the world's going to change based on this grant, this 3-year grant. So you just got to manage expectations. Avoid the implication that you're evaluating the impact or outcome. Stress that you're evaluating what's happening, not how well this person's doing. You're interested in the process, and the person might be part of the process, but let's try to get the person, don't make it personal for people. Make sure the right information gets to the right people, and ensure that data collection is managed on a consistent basis. Again, you don't want to blow off these evaluation components and then, okay, now we have time to do it, but now the grant's running out and this person just we don't have this person to work with us anymore. So these are just pitfalls when evaluations and process evaluations in general. Here's some websites you can go to for evaluations and process evaluations in general. When conducting lit reviews for process evaluations, like I have this, Brad went over this stuff, but he really went through it fast and it was so confusing. So I'm going to do my own little web search for it. If you're looking for process evaluations, there's different terms that you might look under to get information on these, and there's websites that could be very, very useful. But they're again, CDC, and a lot of people call them process implementation evaluations, and some people separate them out. Well, that's that's a little show for today. Sorry that it went a little over time, but do you have any questions or anything? Yeah, sorry I went over, Kedrick. But the people who are here, I mean, like Rachel and Harris County Family Connections. I know some of these guys, Joan and Dolly and these guys. But you guys should know that I don't work with Kedrick every day, but I do work with them. And you guys are so lucky, I think, to have him as running this series, because he's very, very responsible and he's very professional. And he's just a great guy to work with. And so if you have questions, absolutely. And he's probably told you, hey, you can touch with him anytime. That is actually true. And so he does show up, and he is very, very valuable. And he really gets the questions answered. And I appreciate him giving me this opportunity today.
Well, thank you so much, sir. And yes, your presentation was great. No apologies necessary. Everything was quite informative. So does anybody have any questions for Dr. Lian at this time?
I'll just ask a quick question. I'm always looking for easy ways to manage the data. So, our go-to method is obviously spreadsheet, but that can get a little tedious. Is there any sort of platform or program that you would recommend for data management?
Yeah, I mean, the spreadsheet you're talking about Excel then? Yeah, the program I use that's very friendly is SPSS, statistical software package for social sciences. I think statistical package for social sciences, and it's a really wonderful program. They have different, you have to pay for it, but they have different levels of programs. And so I think you can get it for $100 or something for a year or something. But SPSS is what I use, and Excel is really the best. A lot of times, if I'm getting data from others, I like it to give Excel, because everybody has Excel, and just send me an Excel. I'll merge it all together, and then I put it in SPSS. SPSS can import this stuff really easily. SAS is another program that a lot of people use. Some people use a program called R, which is free on the web. I don't really know how to use R, but just because I haven't had time to learn it, but it's on the web, and it's really, really popular now in colleges and at some jobs. But I use this program called SPSS, and that just allows me to do descriptives and to do group stuff really, really quickly. I think you can do that in Excel, but SPSS is just a little easier. But you can't go wrong as long as it's a spreadsheet, and as long as when people are doing data, it's nice if they know that these statistical packages, at the end of the day, they deal with numbers more so than text. So, I'm collecting data on type of insurance. So they're insured, not insured, they're Medicaid, half insured, whatever. Well, code those. So I deal with 1, 2, 3, 4 instead of insured, uninsured, and or like gender, female, male, whatever. Code them 1, 2. Try to put, and so when I'm dealing with, and then create a little code book to the side. But when I get data from people, and you probably will come across this if you haven't already. It's so nice to have the numbers instead of the text, because going and recoding those, converting the text into numbers so the program can give you percentages and stuff is a pain in the neck. So it's nice to code that way beforehand rather than after the fact. But always have a code book so the person who's working with it more thoroughly maybe can at least identify what does number 6 mean for this category. Sometimes you have to do text if it's but if it can be like 10 categories or less, it's nice to work with numbers. But when your spreadsheets are the way to do it, and Excel is really wonderful. If you need any help on anybody here, if they have data that's in Excel and they just want some basic information from it, feel free to send it to me. And converting it from Excel to SPSS takes seconds. I mean, it's nice to have that first row of like line 1, have it named the variable names, age, income, or age, race, name, whatever. Have that first row, column A to have have it labels. And then from row 2 down, have the data. And you can send it to me. I can put it in SPS. I'll give you feedback really quickly. Again, it doesn't take long to press a button, and so all this stuff we done pretty quickly. So any of you guys, if you have data sets that you want to work with, it could be 50 people, it could be 10,000. The computer doesn't really care.
Okay, Brad, I have a question.
Yeah.
You just mentioned that you had a free program. I'm sorry, but Family Connections is not, we don't have a big budget, so we have to do as many things free and modest as we can. What's that free program you mentioned? Was it ARP?
Yeah, it's just R, just the letter. And yeah, it's I never thought about that, but yeah, I mean, when you say some things are just so simple, you just don't, you can't believe it, but it's just R. And if you just Google like R for statistics or something, and you'll get a lot of hits, and like a intro course to R or something, and I think they must have, you must be able to use that on the cloud, or I really don't know. I haven't really, but everything about it is free. The programming and everything is free, and it'll spit out output for you.
All right, thank you so much.
Oh yeah. And you can get if you have little data sets that you think, it's, I can play around with the internet for 3 hours and try, but I could also just send it to Brad, and you could probably do it in 10 minutes. You can talk to Kedrick, and just, don't hesitate to send me little things or whatever, or to call me, or if you need help on anything.
I feel you're gonna get a flood of you're gonna get a flood of people sending stuff in. I just did several events this summer, which I used surveys, which handwritten surveys. Now I'm gonna have to figure out how to get the information from that. So who knows, I may be calling you or sending you stuff.
Well, the data entry is one thing. Data management is another thing. So good luck on the data entry.
I'll do the data entry. I'll have to send you information
when they
after
are
that.
entering the data, try to create if you have like 50 surveys or whatever, and some of them have very strongly agree, or what, I don't know what your responses are going to be, but try to code them to numbers beforehand. So when you give it to people to enter, they're not typing in the actual text answer. They're typing in 1, 4, so, the numbers for those. Create some type of template. So when it's entered, it's entered in numbers instead of having to convert it at the back end.
Okay, that's neat and so much easier.
Yeah.
All right, any other questions?
Kedrick, I trust you're gonna send us copies of the PowerPoint, because I was trying to take notes, but I think I'd like to.
Yes, certainly. When Dr. Lian sends it over, I will share the PowerPoint with all of you all.
And I'll send it in 2 minutes.
So again, thank you so very much. Also, just wanted to share just briefly with you all that this will conclude this GPS seminar series for this year, this 2022 year. But certainly you can go back to our website and revisit the recordings of all of the seminars that have occurred since March of this year over this 6-month period. And you'll see on the screen the titles listed there with each month, beginning with Introduction to Public Health and Community Impact, Building Beneficial Budgets, Searching for Suitable Grants, Proposal Planning and Design, Engaging Communities with Enthusiastic Communication, and today's presentation on Activity Assessment Amidst Implementation. So again, feel free to visit our website to watch the recording videos from each of those presentations. Thank you all so much for joining us, and we do hope that you all have a great day.
Thanks.